Thanks everybody for joining us at GoLocal Live. I'm Josh Fenton, CEO and co-founder. I want to thank two earlier guests, Darrell West from the Brookings Institution, talking about the future of work. He's been on this issue for multiple years and outlining how we will become a much more digital economy. Secondly, I want to thank Director Jensen from the Department of Labor and Training. He is at the eye of the storm. New jobs numbers at the local level pushes us up over 70,000 new unemployment claims and temporary disability in the last 3 weeks. And national numbers show 3.3 million unemployed, 4 times greater than any other previous report of that type. Joining me now is Dr. Michael Fine, former director of the Rhode Island Department of Health. Dr. Fine, thanks again for joining us today.
Always my pleasure.
Okay, let's get into the testing numbers. We had a story today about Rhode Island's lagging behind, certainly Massachusetts and other parts of the country, in implementing its testing infrastructure. To date, only 1,471 have been tested. In Massachusetts, just a shy under 20,000. Even adjusting from a per capita standpoint, Rhode Island is testing at half the level of Massachusetts. Why is this so critical?
Well, testing tells you who needs to be in isolation. Testing doesn't help the care of individuals by and large, but it really does help us identify people who are positive and the people who we need to move to isolation. And this is really critical as we build our infrastructure, because we need testing in order to create isolation opportunities. We can't have one without the other, and we really need those isolation opportunities, I believe, if we're going to do what the Chinese did and prevent the spread of the disease further.
If that's the case, do we need to close the state borders, literally, only allowing commerce in for delivery, commerce out for delivery?
Well, the question really is what to do first. You know, right now we are testing only people who are in the hospital, only people in congregate settings, and only people who are healthcare workers. You know, closing the borders makes some sense if we want to prevent the importation of disease, but it doesn't help us restrain the dissemination of disease when it's here. You know, we have at the moment 132 positive tests, but most of us think that we have many times that, perhaps many thousands of times that, in terms of number of active cases. The challenge isn't to prevent it coming across the borders. The challenge is to prevent all the people who are positive and don't know it from transmitting it to others, particularly people in their households.
Let's go to the numbers. The numbers are obviously daunting. They're growing every day. There's anecdotal stories, 13 individuals dying at a hospital in the Queens in 24 hours. Let's go through the numbers.
Well, again, I always like to start with the number of recovered people. So there are about 120,000 people who have recovered. We will cross 500,000 tested positives today. Remember, the number of cases as we talk about them is really just not, it's not only the number of people with the disease, just really the number of people who we have tested for and found to have disease. We're not testing for thousands of others. But the number of tested positives worldwide grew to over 50,000 new reported cases a day. In the United States, we're up to about 69,000 reported cases. About 14,000 of those are new in the last 24 hours. It's almost double of what we were before. Again, I can't tell you how much of that is more disease versus more testing. In Rhode Island, we have 132 people tested, 8 new positives yesterday. The most significant Rhode Island number to me isn't that number, it's the number of people in the hospital, which has grown to 15. And it's that number we need to keep our eyes very closely focused on.
That jumped from 4 to 15 in just one day.
Right. Now, some of that may be reporting lag.
Yep, absolutely. Let's go back to testing. New York is obviously very aggressive in their testing. Their numbers are big, obviously proportional to their population. They're still doing a much better job and seem to have an infrastructure now in place. Other places around the country, and including Rhode Island, seem to be really struggling with it. We're 25, 26 days in since our first reported case here in Rhode Island. I think it's 26 days. And yet we're still testing at functionally the same level that we were 4 or 5 days into this. Is this I'm going to ask you, is this a panic button issue? No more messing around. We need to be doing 1,000 tests on a daily basis.
Well, I think everybody's working hard to get us there. Remember, this testing is extra complicated. It's not just going and having a blood test. It means that the person obtaining the test has to get fully gowned in full personal protective equipment. So you can't just walk in off the street and have a test because it's Tuesday, Thursday. You really have to have real organization and real clear thinking about who's going to do the test, how the sample is going to get moved, and then you have to have the reagents and the people you need to get the tests actually run, and prioritize the people who are sickest.
But so but Doctor, we're going on a month on this. At what point, and I'm sure everybody's interest is consistent and everyone's effort is hard, but at some point you got to deliver an infrastructure to be able to test people.
Yeah, you do, but from my perspective, the challenge is to deliver first on the isolation opportunities, because testing without isolation doesn't really have much impact. All we get to do is see a number. It's testing plus isolation that will help us contain this disease. So I think the Department of Health and CDC has made, in general, smart recommendations about isolating anybody who's sick at all, regardless of what the source is, as a way to go forward. And that has helped some. But as you say, if we're really going to get on top of this and in front of it and reduce the number of new cases to 0, we're going to need testing plus isolation opportunities and make sure that we have, the robust willingness and ability to move people who are positive into isolation. I think moving people who are positive out of their homes and into isolation, I think that's going to be a big challenge for Rhode Islanders. It's something we're totally not used to, and getting us there is going to be, is going to take a lot of work. We're people who like our families and like our communities and don't ever want to leave them.
Yeah, absolutely. Let's talk about the healthcare crisis and the economic crisis a little bit. These two things are running in parallel. Obviously, the job numbers are the job numbers. At what point is it that you think that America, Rhode Island, can turn back on the economy? I think in the next couple of weeks, that is going to be the #1 discussion point.
Well, for me, from a public health perspective, I don't want to see us open up again until the number of new cases has dropped to 0 3 days in a row.
Yeah.
I don't want to see us open up again until I have a pretty good sense that a substantial part of the population has become immune one way or the other. Because if we open up early, we'll see the reemergence of the spread of disease and more people sick again. So this kind of back and forth looking at the numbers is going to be really important. But first, we've got to get, reasonable numbers to look at, and we are still behind the 8 ball in terms of having the numbers we need to know where we are. I still think we're flying blind.
A lot of experts are saying that really you can't make any judgment about what the impact of this. The New York City health director said, listen, this is going to last until the fall. In her mind, no two ways about it. Is that true?
I think it's going to last at least until the fall, and perhaps a year beyond the fall. A lot depends on how effective we are at building infrastructure. It seems to me all our energy should be devoted to making sure we have isolation opportunities, making sure we have enough ICUs and enough ventilators. I mean, once we have enough ICUs and enough ventilators, the rate of rise of cases doesn't matter anymore. And we can get open earlier. But you would think that we ought to mount sort of a huge national effort, like the Works Project Administration or the Marshall Plan for ourselves, to make sure that we have all the ICUs we need. You know, that plus isolation hospitals will let us have this epidemic and get it over with. Until we have that infrastructure in place, we're kind of at the mercy of the epidemic.
Well, you know, chicken or egg, don't we need all three? Don't we need just mammoth workforce at building the testing infrastructure, building an isolation strategy, and expanding our ICUs? It can't be one of those three missing in the calculus to be able to expedite how we handle this and get out of it.
Yeah, I think I mean, I think getting them all done. And I'm looking to see, I haven't seen yet evidence of the massive mobilization of resources to do those three things. You know, I'm sure some of the planning is happening behind the scenes, but I'd love to see that massive mobilization in order to get us prepared for the disease, and then as quickly as we can, get ready to reopen. You know, essentially, we ought to close quickly, build infrastructure, you know, and then as soon as the numbers support it, get reopened. If we try to reopen before that infrastructure is in place, you know, the disease will be the judge of whether we did that too early or not, because we'll get more disease. This is not, you know, this is not just about somebody's choice. The disease is a harsh taskmaster.
Yep. What else do people need to know as we wrap up?
Simple stuff, you know, isolate if you're sick. You know, we say it over and over again. You know, try to avoid other people in the short run. Stop smoking. Stop smoking yesterday. You know, just be thoughtful and safe. And remember, we're all going to get this disease. For most of us, it's going to be mild disease if we see it at all. So there's nothing to be upset about. We can do this. We can do it together. We're doing it amazingly successfully so far. And I think we'll be successful if we stay in touch and keep working together as effectively as we've done so far.
Dr. Michael Fine, thanks again so much for joining us. It's been wildly helpful and extremely well received. At 2:30 today, Governor Raimondo will be making announcements on the state's response to the coronavirus and what steps her administration are taking today. Again, everyone, thanks so much. We have a very busy day on GoLocal Live tomorrow, so stay tuned on that. And last but not least, thanks to Darrell West, Director Jensen, and to Dr. Michael Fine for joining us today. Stay tuned for more. Thanks, everybody. Stay safe.
Thanks, Josh.